Welcome to the Assembly Committee on Health and Human Services. Would the Secretary please call the roll?
Assemblywoman Gonzalez. Here. Assemblywoman Gorlow. Here. Assemblyman Gray. Here. Assemblyman Hafen. Here. Assemblyman Hibbets. Here. Assemblyman Koenig. Here. Assemblywoman Newby. Here. Assemblyman Wynn. Here. Assemblyman Orentlicher. Here. Assemblywoman Taylor. Present. Assemblywoman Thomas. Here. Chair Peters.
And I am here. Thank you all for being here. I think we've got everybody. A couple housekeeping items before we begin. Please remember to mute your electronic devices before we get started so we're not interrupting folks as they're presenting. Members of the public may provide testimony in a variety of ways, all of which are listed on the agenda. You may also submit public comment in writing, either in addition to testifying or in lieu thereof. Written public comment may be submitted before, during, or up to 24 hours after the meeting adjournment. If you wish to testify in person, please sign in by the door and leave a business card so we have an accurate record of your name and contact information. If you do not testify, you may also want to sign in case we would like to get in touch with you regarding a particular bill. To ensure an orderly flow of discussion, all comments, questions, and responses must go through me. Also, committee members must be recognized by me before you can speak. Additionally, I ask our presenters on Zoom video call to leave your cameras off and microphones muted until it's your turn to present, or if I direct any questions to you. When testifying in person, please turn the microphone on to speak and off to listen so we can avoid a reverb through our recording. With that, we'll move on to our agenda. We have 3 bills listed. We will take them out of order today because we have Senator Wynn in the room with us. We'll go ahead and start with SB 280. Opening that bill, SB 280 revises provisions governing contraception. Welcome, Senator Wynn. Thank you so much for being with us today. We will go ahead and get started.
Thank you. My name is Rochelle Wynn. I represent Senate District 3 in Southern Nevada, and I am proud to present Senate Bill 280. 280 is very thick, and I'm not really sure why, because it only does a couple of things. This bill came to me in my conversations with Dr. Sandy Koch. She is a local OBGYN here in Carson City, and she would be my co-presenter, and she would be able to answer all those doctor-type questions that you might have for the committee. So there may be questions that I will have to either phone a friend or get back in touch with the committee members with any answers. Although she did provide a lot of testimony in the Senate hearing that hopefully I can recall and hopefully not butcher too much through this process. What this bill is I'm going to refer to it because it is a long acronym. It is Long Acting Reversible Contraceptive, and that is known as a LARC. So a LARC, for all the women and men in this committee, is a device that is long-term reproductive contraceptive. So a lot of times you think of it as an IUD. What Dr. Koch had learned during the course of her practice over the past, I think, like 20 or 30 years as an OBGYN here, working outside of Carson City and also in our rural communities, and this was also confirmed by Dr. Senator Titus in the Senate side, that what was happening is women would come in and have children and give birth, and then they would request a LARC be inserted, and at this time they were not able to do so because they didn't have some of those devices, or they were referred to come back and have the procedure done at a later time in an outpatient setting because it was either cheaper. And so we were seeing a drop off in women that were obtaining these types of contraceptive even though they were wanted and requested after birth. Some of the questions that came up and that I can preventatively maybe ask is, some people asked, is it an okay time to get one of these IUDs inserted upon right after a birth? Would your body naturally expel it? Would there be any conditions? And what Dr. Koch has learned in her research and in her practice, that this is actually a very good time to do this. A lot of you have heard like the process of either having one removed in an outpatient setting or inserted, and sometimes there is pain, intolerable pain that is associated associated with the removal of such device or in the insertion of such device. And actually, post-pregnancy, it is a very ideal time to actually insert that. And so this would allow women that request this in a hospital setting to be able to do just that. One of the things that was not included in here, and I anticipate there will be an amendment that follows, and I'm continuing working with different stakeholder groups on what that might look like, is in talking with some of our rural communities, having these devices on hand or readily available in a hospital setting isn't always workable, and so we wanted to expand that definition to also include like shots and other types of things that might be easier to administer in rural settings. So there are lots of different types of long LARCs out there, including IUDs, but also including long-term contraceptive shots that can be given and administered in that same thing. So it is our intention to include that. I know that this was one of the things that Senator Titus was concerned and wanted to make sure it was including to give those rural hospitals in particular some flexibility to provide different types of LARCs in their facilities. And that is essentially what this bill does. So I would be happy to answer any questions. And like I said, there may be questions that I will have to defer or get back to committee members on if they are of a medical nature and I'm not able to recall what the answers were in previous conversations.
Thank you, Senator. Oh, I have a couple questions. We'll go ahead and get started with Assemblyman Koenig.
Thank you, Madam Chair, and welcome to third floor. So yeah, my question and concern again has to do with the rurals on making them available. I know that, and I haven't verified this, but I had some lobbyists in my office claiming that in some of the rural hospitals, they were having difficulty getting reimbursed for the IUDs, and you had brought those up, that they're getting reimbursed for the insertion or removal, but they're not for the actual device, and I think they're getting $35 to insert and remove, and the device is worth $700. And so for them not to receive the reimbursement for that device makes that not practical for some of the rurals to do that. So when you brought up the IUDs was a possibility for that amendment, are you aware of that situation?
Rochelle Wynn for the record, thank you for that question and that concern. That is something that we are continuing to work on. What we wanted to make sure is that people were not charged like exorbitant costs because they were having this procedure in a hospital. As we all know, if you have an hospital procedure done, it tends to be more expensive than if you have an outpatient procedure done in like a medical office. And we wanted to ensure that that was that we were protecting patients from, not being charged a ridiculous amount just because they were in a hospital setting, as opposed to coming back, 4 or 5, 6 weeks later, if at all, to have that done in an outpatient setting. So there is some protection in the law. We are continuing to fine tune that, what that looks like. And that's part of the reason we also wanted to include the shot, because then they wouldn't have to carry those devices, which can be expensive.
Thank you for addressing that concern.
Thank you for the question. Well, I'm waiting to see if anyone else has other questions. I wanted to touch a little bit on the cost as I was thinking about the cost of a birth and then the request to have a long-term contraceptive device at the same time as that cost of birth is being incurred. The potential cost savings 9 months, 10 months, 15 months down the road seems to offset the cost of inserting a $500 IUD that can last up to 12 years or so. It's funny to me when we pinch pennies like that, but we're not looking at the cost benefit, and maybe it's our biennial budgets that keep us from seeing those like long-term impacts and costs. But Assemblyman Hibbets, please go ahead.
Thank you, Chair. Thank you, Senator, and welcome back to the third floor. I know we're not a money committee, but as policy goes, this is a money policy. So I'm just curious, if I may, I went through the fiscal impact statements. the fiscal notes. One said that there was X amount of dollars. Another from the similar agency in a different county said there's no fiscal impact. In fact, this will save us money. On the bill, it says may have fiscal impact and says contains an unfunded mandate, but I'm not understanding where that comes in. Can you explain that by any chance?
Rochelle Wynn, for the record, I'm not clear on that as well. I think it goes to the point that your chair just mentioned, that the cost of this would be, these are covered procedures. This isn't a procedure that's not covered either by, I believe it's covered by Medicaid, and it's also covered by most private insurance. And I'm sure there are other people that can testify as to that. So this isn't a new process. We're not requiring something new. We're just requiring a new location for it to be covered in. So you can have this done in a hospital, you can have this done in an outpatient, and this just brings that clarity so people, when they are requesting it, we can avoid the more expensive costs of an unwanted pregnancy down the line. And so, to the chair's point, that the long-term cost savings of a $500 to even $1,000 IUD is probably, actually saves us money as a state.
Perhaps legal can explain where this came from?
Yes, Eric Robbins, LCB Legal. So basically, any time that that we adjust or that we impose requirements relating to insurance coverage, and those requirements apply to local governments that have insurance for their employees, we do put an unfunded mandate on it, and we also do note a fiscal effect. And basically what noting the fiscal effect does is it requires our fiscal division to go out and solicit those fiscal notes from the agencies that will know better as to whether it does have a fiscal effect or not. And then the unfunded mandate just satisfies the legal requirements in case it does. But just because those are noted on a bill doesn't necessarily mean that it does have a fiscal impact or an unfunded mandate. It just is there in so that we get those fiscal notes, and then if one comes back, so that we're covered on our legal basis.
And Rochelle Wynn, for the record, it did come out of the Senate unanimously, and it did not get taken into a money committee.
Thank you, Chair, and thank you, legal, and thank you, Senator. And I did note that, by the way.
Thank you. I have Assemblywoman Newby next, and then Assemblywoman Taylor.
Thank you, Madam Chairwoman, and thank you, Senator Wynn, for bringing this bill. I think it makes a lot of sense. Having had kids myself, after you give birth, you're in that fog for some time afterwards, and childcare is hard to find. And so trying to find the time to go and get all of the exams and inserting and everything is just so much more. I wonder if you have you heard from women's groups about that and about that aspect of, just carrying on with women's lives after they've given birth, and maybe lightening that load?
Rochelle Wynn, for the record, that was part of the motivation to bring the bill, is as a mother myself, that is definitely the case, is after you go home and you have this new child that you have to take care of, sometimes women's health and women's choices get put to the wayside just because time and life happens. And so if there is an opportunity, and there are women that know that they want to immediately be on these long-term these LARCs, then this gives them the opportunity to do that. I think, and I can get you more information, but I think there is a drop-off of about 19% of those people that would request it in a hospital that don't come back and get it done later on. And that may lead to unwanted pregnancies or unexpected pregnancies, or any one of those kind of circumstances that maybe they weren't mentally and physically prepared for. Especially shortly after giving birth.
I was like listening to my biography right there. I held my husband's hand 6 months pregnant while he got a vasectomy because we had an unexpected pregnancy resulting from both of our failures to follow up with our physicians. She's wonderful. I'm so grateful we have her, but there was definitely a decision we had to make that cost us more money than if we had just been able to get things done on the offset. Assemblywoman Taylor.
Thank you, Madam Chair, and thank you, Senator, for bringing the bill. And again, welcome back. I want to make sure I understand what we're attempting to get our arms around here, because it certainly seems to make sense, but I want to make sure that I get it. So really what's going on now is it's difficult for women to have an IUD or other LARCs, right, placed during the time when they're giving birth. And this bill is hoping to clear that up and to make that possible. And I see some limitations on what a third-party insurer, what the hospital can charge, the third-party insurer and so on. And I certainly understand that adding the shot as an option for those in rural Nevada that may not carry these devices because apparently they're pretty expensive. So really, it's like making it really, really clear that this can happen during when they're in the give birth, when they're having birth, and that really we're expecting insurance to be a part of helping to pay for this. So something that can happen during that time. And do I have to kind of have it in a nutshell?
Rochelle Wynn for the record. That's correct, Assemblywoman Taylor. We just want to make sure that it is an option for women while they're in the hospital after they have given birth, before they go home, that they can have one of these inserted if they choose to ask for that. And they don't have to come back and have it done in an outpatient setting. They can have it done when they are there.
Okay. Follow up, please, Chair. Thank you. Thank you, Senator. So so they can have it then. It doesn't have to happen. It's optional, obviously, and they don't have. It's not to say that you have to have it during the time like the baby comes out. The IUD goes. It's not like, right? It doesn't have to happen at that, but it's during that time if that's what that family chooses that they want to do.
Rochelle Wynn, that's correct. I don't know the whole medical procedure and when they do it, but usually you're in the hospital for a little time after you've had given birth, and the circumstances obviously differ for every individual, to speak with their doctor to find out if that is the appropriate thing. I know with me, I had a cesarean section, and I was asked if I wanted to have my tubes tied. And in my pregnancy phase, brain, post-pregnancy, I was like, no, I think I might want to have more kids, if I could go back. But it made it more fun for my husband to have a procedure. So, yes, and I made him follow up, although your flower is beautiful. So that's the intention.
Okay. Thank you very much. I appreciate that. Thank you, Chair.
Thank you. I have Assemblywoman Thomas next.
Good afternoon, and thank you, Madam Chair. And thank you, Senator, for bringing this bill forward. My question actually has to do with history and pushback. The reason why this bill is being pushed or being brought forward, is it because of the pushback that you're getting from the hospitals? Because I would think that doctors, after a woman has a baby, that would be the optimum time to insert or tubal ligation, either one of those procedures. So is there a pushback on this bill?
Rochelle Wynn, for the record. I haven't received any pushback. I think it's just a policy that it's good to put it in place. I think women and our access to, reproductive contraception is something that is timely. Like I said, this doesn't create new things. These are covered in the hospital. They are covered in outpatient. I think it is something we just want to make sure. The only pushback I've had, and we've been working through it, and I'll continue to listen and work through it, is to just make sure that this cost piece is equitable for not only the insurers, but also the hospitals. Assemblyman Koenig had brought up a good point. We don't want it to make it so it's like a free device. We want to make sure that the device costs are covered in that. We just want to make sure that patients are protected, that they're not charged hospital prices for an outpatient procedure in this limited circumstance.
Are there any other questions from the committee? You did really well without a call a friend. Impressive job, Senator. We will.
Rochelle, for the record, I think you guys were just being nice to me, but thank you.
Thank you. We're going to go ahead and move into testimony. Thank you so much. We will start with support testimony in our physical locations and then move to the phone. If there's anyone who's in the audience in Carson City or anyone in our vacant room in Las Vegas, please come to the desk for support testimony. We will start here in Carson City. Please remember to state your name for the record. You may begin when you're ready.
Hello, Chair and members of the committee. My name is Vanessa Dunn, Vanessa-Dunn. I am here on behalf of the Nevada Public Health Association, also known as NPHA. SB 280 increases access to reproductive health care and aligns with the goal of NPHA. Thank you.
Thank you. My name's Caroline Mello-Roberson, CAROLINE-MELLOROBERSON. I'm the Southwest Regional Director for NARAL Pro-Choice America and the lead staffer here in Nevada. I submitted formal comments that wanted to speak in support. We have 48,000 members in the state. We're really proud that this state continues to advance and protect reproductive freedoms, including access to contraception. I will note, I think some of you were here in 2017 when we voted to allow for no copays codified in the state law for IUDs. And so, as many noted, this is a cost that will pay dividends in the future, allowing people that access. I remember I myself got an IUD soon after giving birth, and one of the best decisions I've ever made. And so I encourage you to support this without the delay. Thank you, Senator, for bringing this forward, and thank you, Dr. Koch, who's not here, who I know was a big part of making this happen.
Chair and members of the committee, Jessica Ferrato here today on behalf of the American College of Obstetricians and Gynecologists. We're here in support of SB 280. The Affordable Care Act requires that long-acting reversible contraceptives, including IUDs, implants, and Depo-Provera, are covered without copays. Unfortunately, multiple factors inhibit a patient's ability to obtain these in a hospital setting. SB 280 attempts to remedy some of these barriers. Most importantly, the legislation requires a device to be available if a patient requests such a device. It's important for long-acting reversible contraceptives to be available for women, especially after giving birth. Thank you for your consideration and appreciate your support for the bill.
Thank you so much. Seeing no one else coming up to the desk in Carson City and Las Vegas, we'll move to the phones. BPS, is there anyone on the public line for support testimony at SB 280?
To testify in support of Senate Bill 280, please press star 9 now to take your place in the queue.
Good afternoon, Chair and members of the committee. For the record, my name is Shelby Swartz of Battleborn Progress. I'm calling in staunch support of SB 280 because our hospitals need to ensure they are able to provide IUDs to any patient requesting it, particularly post-birth. I am currently pregnant and am keenly aware of how necessary birth control access is in the crucial period following childbirth. The insertion of an IUD post-delivery can provide women and pregnant people with crucial peace of mind during the intense and confusing postpartum period. Some people are actually more fertile after the birth of a child, and the lack of access to birth control can spell disaster for a new parent who needs to focus on their brand new baby. We know that access to reliable, effective birth control is liberating for individuals and helps them protect their bodily autonomy. That is why I'm calling in today to support SB 280 and to urge the committee to support this bill. Thank you.
Thank you. Next caller, please.
Thank you, Madam Chair and members of the committee. This is Matt Robinson with Argentum Partners, testifying on behalf of Carson Tahoe Health. We are here today in strong support of SB 280 and really want to thank Senator Wynn for working with us on language that includes coverage of the device as well as the procedure. And again, we're in strong support of the bill and urge its passage. Thank you.
Thank you. Next caller, please.
Good afternoon, Chair and members of the committee. My name is Brianna Escamilla, BRIANA ESCAMILLA, for the record. and I'm calling on behalf of Planned Parenthood Votes Nevada, and we are in strong support of SB 280 because we believe that all people deserve to have accessible and reliable birth control, and that we think this bill will help move us in that direction. And we strongly support this bill, and we encourage you to do so as well. Thank you.
Thank you. Next caller, please.
Chair, there are no other callers to testify in support at this time.
Thank you. We'll go ahead and move into opposition testimony then. Is there anyone in Carson City or Las Vegas who would like to provide opposition testimony? Please remember to state your name for the record. You may begin when you're ready.
Good afternoon. My name is Patrick Kelly with the Nevada Hospital Association. We do not oppose the primary purpose of this bill. As Senator Wynn indicated, there are two things that we have concerns about. One is the verbiage related to payment, and the second is allowing rural hospitals to have injectables as an option under the bill. So we've been working with the senator. We will continue to work with her, and we appreciate all of her efforts, and thank you for your time.
Thank you. Seeing no one else in Carson City and no one coming to the table in Las Vegas, we've moved to the phones. BPS, is there anyone on the public line for opposition testimony on SB 280?
To testify in opposition to Senate Bill 280, please press star 9 now to take your place in the queue.
Good afternoon, Chair. Are you guys able to hear me?
Yes, we can. Please go ahead.
Good afternoon to you and your committee. This is Dora Martinez representing the Nevada Disability Peer Action Coalition. Madam Beautiful Chair, I was actually calling in to support this bill.
Thank you for letting me know. We can reclassify your testimony in support. Please go ahead.
Okay, thank you. Thank you to Senator Wynn for sponsoring this bill. As a representative of people with disability of Nevada, disabled population of Nevada, this is one of those things that falls under the informative choice. So we are very thankful for her to support. We are in support of this bill. Thank you so much. Have a good day.
Thank you for your testimony. BPS, is there anyone else on the line?
Chair, there are no callers to testify at this time.
Thank you so much. We'll move into neutral testimony. Is there anyone in the room who'd like to provide neutral testimony? Seeing none in Las Vegas, we'll start here in Carson City. Please remember to state your name for the record.
Thank you, Madam Chair, members of the committee. Blaine Osborne, Nevada Rural Hospital Partners, for the record. We're here in neutral on Senate Bill 280 today. We've been called out several times during this hearing regarding working with Senator Wynn and trying to get that language correct. So still need a little bit more time to get that figured out for those contraceptive injections, as well as working on those payment provisions in subsection 4. Thank you.
Thank you. Seeing no one else come to the table, BPS, would you check the public line for neutral testimony on SB 280?
Chair, there are no callers to testify in neutral at this time.
Thank you. We had all right, I think they're taking it offline. Senator, would you like closing remarks today? No. All right, we're waiving closing remarks. I'll go ahead and close the hearing on Senate Bill 280, and we will open the hearing on Senate Bill 298, which revises provisions governing the involuntary discharge of a resident from a residential facility for groups. Welcome, Senator. Thank you for being here. It's my understanding that you have a co-presenter-ish on Zoom who is available. If we could get her up on the Zoom, that would be great. I think that is Miss Coe. Hello, welcome. Thank you so much. Please remember to state your name when you speak so that we have a clean record. You may begin when you're ready.
Thank you so much. My name is Melanie Scheibel. I'm the state senator for District 9, and I'm happy to be here today presenting SB 298 to you. SB 298 came out of the Interim Legislative Committee on Senior Citizens, Veterans, and Adults with Special Needs. I was delighted to sit on that committee with a fantastic chairperson, and at the conclusion of that interim session, we voted on a couple of different proposals to bring forward bills to clean up or address issues that people in those populations, senior citizens, veterans, and adults with special needs were facing. And one of them in particular is people who are being discharged from a specialized facility. When people are in a specialized facility, they don't have the same landlord-tenant protections that the rest of us do who rent a home or an apartment or another place that we live. And so the purpose of SB 298 was to provide some kind of process and policy for those individuals who might be being removed from a group home setting to ensure that they have some due process before they are ultimately removed and sent to another facility. And really, I am not the expert on this. Ms. Coe is the expert on this. She is the interim ombudsperson in this department. And so I'd like to turn the presentation over to her to walk through the bill, and then we'll both be here to answer any questions you might have.
Welcome, Ms. Coe. Thank you so much for being here. Please remember to state your name before you speak. You may begin.
Thank you, Chair Peters. My name is Marie Coe. I am the State Ombudsman for Nevada. I have the pleasure of being the State Ombudsman and representing residents who live in care facilities throughout Nevada. This bill provides increased discharge protections for residents, along with consistent criteria for providers to follow if discharge is needed. Residents have been discharged into our communities without assistance when care was needed and without ensuring care can be provided at another setting. Promoting transparency for the reasons residents may be discharged and the ability for advocacy is a benefit to residents and providers. I am available to take any questions regarding the specifics of this bill.
Thank you so much. Committee members, questions on the bill? Assemblywoman Taylor.
Okay, thank you, Chair, and thank you, Senator, for being here and for bringing this important bill. I want to make sure I understand the problem that we're trying to get our arms around here. It sounds as though those vulnerable populations that you mentioned, sometimes as they're getting released from these specialized facilities, that they don't have a reason why, or they don't have. You mentioned there are some protections that they don't have. I'm wondering if you can kind of share a little bit about behind that.
Sure. Melanie Scheibel for the record. We're talking about people who live in a residential facility for groups, as defined in the NRS. So we're not talking about people in a normal apartment setting. We're talking about somebody in, an assisted care facility, or perhaps a medical care facility. And so one of the common issues that we were trying to address is that sometimes these people are discharged or removed from the facility because either the facility is no longer the right fit for them, they need a higher level of care, they need a lower level of care, or sometimes that might actually be their disruptive behavior, and they're not being afforded an opportunity to rectify the behavior or being informed about what it is regarding their condition or their particular situation that makes them a bad candidate for that facility. And so what SB 298 does is it requires that before a facility serves a person with the discharge paperwork that says you're no longer, you no longer require the services of our facility. You need to go somewhere with higher level of care or lower level of care. They have to provide before that time notice to the patient or the resident and say, look, it looks like you're going to be needing a higher level of care. So over the next 30 days, you need to start looking for a facility that provides X, Y, and Z, because that's what we don't provide here, instead of waiting until the day comes for them to actually leave the facility. And I would, invite Ms. Coe to chime in if I've misstated any of that or missed anything.
Thank you, Marie Coe, for the record again. Senator Scheibel was correct on many of the reasons residents have been leaving these facilities. Residents have lacked the ability to dispute the reason. And so this gives them the ability to ask for advocacy, as well as a consistent methodology that the facility providers would be able to discharge. This is similar to what is currently happening in skilled nursing facilities. And I will also note that many residents are having care needs that need to be met. They need a facility to have those care needs, and they're being sent to the homeless shelters or sent to the hospital and not afforded the right to return to the facilities once their acute needs have been met. And so this would resolve many of those issues as well.
Thank you so much, Ms. Coe and Senator. Thank you, Chair.
Thank you. I have a couple other questions. I'll start with Assemblywoman Gonzalez and then go to Assemblyman Nguyen. Oh, great. Okay, then we'll go to Assemblyman Nguyen.
Thank you, Madam Chair, and thank you, Senator, for this bill. I'm very familiar in this committee of asking the same line of questions, so I'm very, very pleased to see that in Section 11 of your bill address the language access. So I really want to commend you on behalf of, just not just my district, but also the district that you serve, that language access is one of the critical component of the things that we're trying to do here in Carson City. I just have a small question for the Ombudsman in terms of the number of cases that she may have dealt with in terms of language access. If you could give us a little history on that, that would be awesome.
Thank you, Senator Nguyen, for the question. Marie Coe for the record. We currently do not collect data regarding language access. That is something that is a focus within the department. And I am pleased to tell you that we are working on translation services of a lot of different documents. But in terms of cases where language access has been a barrier, we don't have that data to provide. We use different tools such as the language line to be able to communicate with people. We also just produced a document to be able to communicate better with residents in the facilities at the moment and to determine the language and give us the ability. As far as data, we don't have that right now.
Quick follow-up, Chair. Thank you. So I just want to make sure that if there are challenges in terms of the issues that arisen out of these cases, that obviously your office is the stop for folks who have challenges that they're dealing with in terms of language access.
Marie Coe for the record. Yes, my office would be the advocacy group to be able to help assist the residents. And if there was language access, we would address that.
Great. Thank you so much. And thank you for the promotion. Thank you, Chair.
Oh, no. Well, I called Assemblyman Watts speaker the other day, so, we're all on a roll at the end of session. I have one more question on my list. Assemblywoman Thomas, please let me know if I missed you.
Thank you, Madam Chair, and thank you, Senator, for bringing this forward. My question actually has to do with, of late we've seen on TV and in the paper where a lot of people that do not have financial access are being turned out from hospitals, and or this bill would prevent a lot of that from happening. Yes or no?
Melanie Scheibel, State Senator for District 9. This would definitely make a dent in that problem. I'm not going to say that this solves the problem of people without the financial means to afford the care that they need or a housing facility that we would be able to cover it. That's a larger question about how we finance social safety nets in the state of Nevada. But what this does do is it provides them with the right to have that information shared with them and some notification. And so, speaking to the financial situation in particular, it's important, and it is covered in this bill, that if a facility is going to discharge somebody because they are behind on their payments, they have to give them the opportunity to catch up on those payments first and explain to them what payments might be behind, because it's not always as simple. And I think Ms. Coe could probably speak to this better, but it's not always as simple as your rent is $1,000 a month and you pay $1,000 a month. It might be that you're getting some subsidy from Medicaid or Medicare, or it might be that you're receiving some benefits, or you're receiving a Social Security check, but then you have, multiple costs. It's not just one line item. And so helping residents to understand the reason that you're behind and how much you're behind is this much, instead of just, involuntarily discharging them is part of what we're trying to address.
Thank you for the question. We added one more question on, so Assemblywoman Newby, please go ahead.
Thank you, Madam Chairwoman, and thank you for bringing this bill, Senator. My question, I've been in a number of different group homes in my work in the past with the Public Guardian's Office, and sometimes they're just regular homes with a couple of folks living there. And so I'm wondering, if one of the residents is violent or develops some sort of behavior that is impacting the other residents, does this bill give any sort of cushion for those residents? I know it provides that there be notice, but what if that person really is harming another within the home?
Melanie Scheibel for the record. This doesn't change the ability of the operator of that group home to remove that person from the facility. It just provides that they have to be given notice, and it also provides that appeal process, which doesn't necessarily mean that they can appeal the process and remain in the facility. But if they want to return to the facility, especially, for example, if they've gone and received treatment at the hospital, acute treatment, they've gone to an emergency room or something like that, and they want to come back, it doesn't guarantee them the right to return, but it provides an avenue for them to contact the ombudsperson and explain why they want to return to that facility, and opens up a line of communication to make that, to make it possible. Doesn't guarantee it, but it provides them with an avenue to try to seek that if that is what the patient or the resident wants. Does that answer your... Ms. Coe might be able to better explain what I'm trying to say.
Thank you, Marie Coe, for the record. Residents who are experiencing behaviors and could be a risk to others, as you were saying, Woman Newby, that does happen on occasion. And if the resident needed to receive acute treatment to resolve the behaviors, then a conversation could be had about returning to the facility. But if they were not appropriate anymore and needed either a higher level or a behavioral facility, then the provider would not be required to have them return. We know that happens at times, and the other residents that are at the facility don't need to be exposed to the other resident who could be posing a danger. So that would be a reason that they could be discharged from the facility.
Thank you so much for the questions and responses. Any other questions from the committee? Seeing none, we will go ahead and move into testimony. We will start with support testimony in our physical locations and then move to the phones. Is there anyone in the room who'd like to provide support testimony on Senate Bill 298? Please remember to state your name for the record. You may begin when you're ready.
Chair, members of the committee, Jonathan Norman with the Nevada Coalition of Legal Service Providers. We were at the interim committee where this was presented, and I think, with our work with adults and guardianship, and then working with Ms. Coe and then Jennifer Richards at ADSD, we hear reports, I would say every month, of people who are discharged pretty much to homeless shelters in this setting where they haven't had the opportunity to have any kind of normal procedure for losing what is essentially their home. So we're in support of this bill. Thank you.
Thank you. Seeing no one else coming to the desk in Carson City or Las Vegas, we'll move to the phones. BPS, is there anyone on the line for support testimony on SB 298?
To testify in support of Senate Bill 298, please press star 9 now to take your place in the queue.
Good afternoon, Chair and the committee. This is Dora Martinez with the Nevada Disability Action Coalition. Many grateful thanks to Senator Scheibel. You are awesome. We support this bill, and thank you.
Thank you. BPS, please add the next caller.
Chair, there are no other callers to testify at this time.
Thank you so much. We'll move into opposition testimony. Is there anyone in Carson City or Las Vegas who'd like to provide opposition testimony to Senate Bill 298? Seeing no one approaching the desk, BPS, is there anyone on the public line for opposition testimony on SB 298?
Chair, there are no callers to testify in opposition at this time.
Thank you. We'll move into neutral testimony. Is there anyone in Carson City or Las Vegas who'd like to provide neutral testimony on SB 298? Seeing none, BPS, would you check the public line for neutral testimony on SB 298?
Chair, there are no callers to testify in neutral at this time.
All right. I will ask the sponsor she's waiving final remarks. Thank you so much for being here. We'll close out the hearing on Senate Bill 298 and move on to Senate Bill 260. Welcome, Senator. Thank you so much for being here. I know you're running around in the assembly today, so we appreciate you making time in your schedule for us as well. Please remember to state your name for the record. SB 260 revises provisions relating to certain persons providing referrals to group housing for persons who are aged.
Thank you very much, Madam Chair, and it's a pleasure to be back in Assembly Health and Human Services. So good afternoon, Chair Peters and committee members. My name is Marilyn Dondero Loop. I represent Senate District 8 in Clark County, and I'm pleased to present Senate Bill 260 to all of you today, which revises provisions relating to certain persons providing referrals to group housing for persons who are aged. I'm just going to quickly go through the sections of the bill, and then my friends here at the dais with me will introduce themselves and give you some additional information. Section 2 defines the term senior living community to refer to certain facilities or other living arrangements for people who are aged, including residential facilities. Section 3 of this bill defines the term senior living community referral agency as a person who refers individuals to a senior living community. Section 4 of this bill requires that all unlicensed senior living community referral agencies disclose certain information to a person that is aged or is a representative of that individual, and to obtain consent before a referral can be made. This section also requires the senior living community referral agency, as defined in Section 3, to 1, maintain a record of disclosure and/or consent for at least 3 years, and 2, provide a copy of this record to certain entities. Section 5 prohibits an unlicensed senior living community referral agency from referring a person who is aged of the representative of such a person under certain provisions. This section also requires an unlicensed senior living community referral agency to establish a policy that protects the privacy of an aged person and their representatives, preventing the selling of their personal information. Additionally, this section requires an unlicensed senior living community referral agency to stop contact and/or referrals for an aged person or their representative upon request. I'm going to, like I said, let my two co-presenters go ahead and introduce themselves and then give additional information, and then we'll be ready for questions. Thank you very much.
Thank you. Please remember to state your name before you speak. You may begin.
Thank you. Good afternoon, Chair and members of the Assembly Health and Human Services Committee. Ashley Cruz with Career Nevada for the record. I just want to thank Senator Dondero Loop for bringing this bill forward, and I will turn it over to Nana Boyer, who is here with us from A Place for Mom. She's going to walk through why we think this bill is important, and then we'll stand for questions. Thank you.
Good afternoon, Chair Peters, members of the Assembly Health and Human Services Committee. Nana Boyer, Nana-Boyer, for the record. I am the General Counsel for A Place for Mom, which is a nationwide senior living referral agency. Nevada is currently the only state in the United States where senior living referral agencies have to operate on a subscription model. Senior living communities have to subscribe to our services, and they pay a set subscription fee regardless of whether it places senior in the community or not. This model actually harms the business of the communities as well as seniors, because under the subscription model, the communities are forced to pay for a service that they rarely or never use. This in turn can price some of the smaller communities out of using our services altogether, and those smaller communities may be just the right fit for the families. So the result is that some of the smaller communities in the state choose not to work with us at all, making it difficult for us to help families to find that best fit for their loved ones. The goal of the bill before the committee today is to align the interests of all three parties involved in the process, the senior and their family first and foremost, the referral agencies, and the senior living communities. So we ensure that ultimately the senior moves into the community that best serves their needs, and that we as a referral agency are able to refer them to that community. We are certain, just knowing that this is how we operate in the other 49 states, that this alignment happens when we're able to charge communities a per move-in fee when the senior actually moves into the community and when the communities are actually using our services. Just to note, the services are always free to families with which we work, and the fee is only ever charged to the community into which the family moves. We do believe that this change, along with the consumer protections that the senator outlined, and some of the clarifications of the duties and responsibilities of the communities, will protect our most vulnerable populations and also benefit the communities which they're joining. Happy to answer any questions, and thank you for your attention.
Thank you so much for the presentation. Committee members, questions? All right, I'm going to start with Assemblyman Hibbets, then go to Assemblyman Nguyen. Please go ahead.
Thank you, Chair. I might be missing it. I'm looking to see what the penalty is for violating the proposed bill. For example, let's say that I'm running a referral agency and I refer the aged person or the representative to my brother who runs a senior living facility. That would be a violation of the proposal of this bill. What's the penalty? Or is it in here and I just don't see it?
Ashley Cruz, for the record, through you, Chair, to the
And go
Assemblyman.
direct.
Thank you. I do not have that off the top of my head, and it's not outlined in the bill. However, we are happy to get that answer for you and get it back to you unless legal has another answer.
Mr. Robbins?
Eric Robbins, LCB Legal. I would need to look that up.
Thank you.
Thank you, everybody.
Assemblyman Nguyen.
Thank you, Madam Chair. This is just a curiosity question. I know that we are learning terms, and I'm a freshman, so I'm learning terms as I go because we have so many new vocabulary here in this building. And so one of the things I'm learning is now I'm learning that we're not talking about, 55 and older anymore. We're talking about 55 and better. That's a new term I learned. It's better, 55. So in terms of the senior, and I really like the language, this persons who are aged. Like, wow, you learn something new again every day. Do we define that age somewhere in this NRS or statute, or and this might be a legal question as well, is that when we talk about senior living communities, is there a minimum in terms of that age, or we're just going to loosely define it and kind of let folk figure it out? So this is maybe ask a friend question, but it could be this friend or that friend.
Non-avoid for the record. I'll give it a shot. I believe that each community has its own criteria, which is why we're not looking to create a cutoff of the low end of the age. So serving different kinds of senior living communities, assisted, independent, memory care, age isn't always the biggest factor, and the communities are free to define what their population is. And so we thought that was not necessary, but if the committee feels otherwise, we're happy to discuss that as well.
Marilyn Dondero Loop for the record. I can speak from not my personal experience, but my sister-in-law's, who used a place for mom twice. And one time with her mother was younger, but she'd had a stroke. So she needed that service to have someone help the family. But then when she used it with her father, she used it twice because her father's needs changed. Her father went from being a functioning sort of aged person who became very much, had very severe dementia. So he needed a different kind of care. So those are three kind of examples of different ages that still needed different kinds of care.
Thanks.
So quick follow-up, Chair. So that just means that with that answer, thank you, Senator. So they don't have to be a senior to use the service. They can be anyone.
Marilyn Dondero Loop for the record. This is just sort of my personal opinion as being a better person, as you described us. I would tell you that there are, when you went to look at a place, if they said 55 plus, you certainly probably wouldn't go in there as a 45-year-old. But if you were married, for example, and you were 55 or 60 and you went in there and the other person was 45, I suppose that they could make that determination. I don't know if that answers your question, but it's really about the facility more than a place for mom.
We also have a response from fiscal. If we could, Mr. Robbins, please go ahead.
Yes, Eric Robbins, LCB Legal for the record. So the original question was about what constitutes a person who is aged for the purpose of this bill, and that was not included in the bill. There's no there's no specific requirement there, and the reason that wasn't included is because this is basically placing requirements on senior living community referral agencies rather than, what constitutes a senior living community. So it's more about what these types of agencies do as their business rather than who is actually living in these communities. So we didn't really think that it was necessary to establish a specific age limit here, and it would just be anyone who I would think would be advanced in age and need services commonly provided to persons who are older.
Thank you very much. Learned something new again today. Thank you, Senator. Thank you, Chair.
Thank you for the question. Our next question comes from Assemblywoman Taylor. Please go ahead.
Thank you, Chair, and thank you, Senator. Welcome to the third floor. And what we do here, and thank you both for being here as well and for bringing the bill. I have my mom is just turned 80, and she lives with me, and so this is something that's really important to me. In the event that she can't continue to stay with me, I want to make sure this is my day. I think I didn't have enough coffee because this is my day. Let me just make sure I get it. So what's happening now is that because we're the only state where senior facilities have to pay a referral, right? They have to pay the facilities have to pay a referral fee in order for for seniors to be referred to them. And this blacks out some of the smaller facilities, and then it may not give the seniors, their family members, may not open up as many options as possible so they can find the right place for them. Am I getting my arms around this?
Nana Boyer for the record. Thank you, Assemblywoman, for that question. Almost, yes. The facilities pay us a referral fee in all of the states. In all of the states but Nevada, they pay us on a move-in basis. So the family contacts us, we identify the facility. Only if they move in and stay a month do we then charge the facility. Only in Nevada, we collect an annual subscription fee, so we're essentially a marketing service. We provide the information of the families that may be interested in a certain community or facility, and the family then goes through the process of touring and moving in. So there is little incentive for referral agencies to continue to provide those referrals because regardless of whether they refer one family or 100, the compensation that the referral agency receives is the same. So the expansion of of our network in Nevada and agencies like ours is limited just by the fact that we get compensated the same regardless. And at the same time, as you mentioned, some of the smaller facilities for whom, I don't know, $500 might be too much, will just not use our facility. Whereas if we were able to operate on a per move-in basis, they would have to pay us nothing until they got a paying resident who stayed a month, paid their rent and care, and only then would they have to pay us anything. And we would have the incentive to refer, obviously.
Thank you. May I follow up, please, Chair? Thank you. It sounds as though it's almost aligning it as someone who's looking for an apartment, and they have an organization that helps them find an apartment. That apartment gets paid once that person moves in and pays some rent. They don't pay you just to be on their list and to send out their brochure and maybe set up a tour.
Nana Boyer for the record. That's absolutely correct. There is a lot of analogy to realtors, brokers in the real estate business here. And as I mentioned, the families never pay us anything. There's no contract, there's no obligation ever. The communities in, again, every other state pay us nothing. We feature them on our website, we promote them, we create a lot of visibility, we learn a lot about these communities, but until we refer a family that moves in, pays a month rent and care, we don't get paid anything.
Well, it seems like, if I may just close this with a comment, Chair, it seems as though that better serves the families because they get all of the options that are available to them. Because if in the event I need to use this for my mom or anyone else who may have, or Senator, as you said, your sister-in-law said, you want the best possible option, not just because they could pay the fee or did pay the fee or whatever the case may be. So I appreciate that. Thank you so much. Thank you for the clarity. Thank you, Chair, for your indulgence.
Thank you for the question. Mr. Robbins has a response to the penalty question. Please go ahead.
All right, Eric Robbins, LCB Legal, for the record. So the answer to that question is these are licensed facility, or these referral agencies are licensed entities under Chapter 449. So if they did not comply with the provisions of this bill, they would be subject to actions against their license and administrative penalties under NRS 449160 and 449163. And the monetary penalties would be an administrative penalty of not more than $5,000 per day of each violation. There are not criminal penalties attached to this, but there could also be an action by the Division of Public and Behavioral Health to enjoin violations under NRS 449.220.
Hope you followed that. Please go ahead.
Quick follow-up on that. I'd refer you to Section 10 of the bill, NRS 449.0305, and I'm not sure if this actually applies directly or not. It says person who violates provisions of this subsection, Attorney General, fine of not more than $10,000, subsequent 10 to 20,000. I was just curious as to if that also applied to the new portions of the bill.
Eric Robbins, LCB Legal, for the record. No, that wouldn't apply to the new portions of the bill. That just applies to subsection 4 here that prohibits a business license pursuant to this particular section from referring or from violating the provisions of section 4. And those penalties are very specific to that subsection, so they would not apply.
Thank you very much. Thank you, Chair. I appreciate the latitude. And thank you to the presenters for allowing me to hijack your presentation.
Thank you for the questions. All right, and any other questions from the committee before we move into testimony? All right, well, thank you so much for the presentation. We'll move into testimony, starting with support testimony in our physical locations. If you are here or in Las Vegas for support of Senate Bill 260, seeing no one come up to the desk, we'll move to the phones. BPS, is there anyone on the public line for support testimony on Senate Bill 260?
Chair, there are no callers to testify in support at this time.
All right, opposition. Is there anyone in Carson City or Las Vegas to provide opposition testimony to Senate Bill 260? Seeing none, BPS, would you check the public line for opposition testimony on Senate Bill 260?
Chair, there are no callers to testify in opposition.
Thank you. Neutral testimony. Is there anyone in Carson City or Las Vegas, which is very empty right now, for neutral testimony on Senate Bill 260? Seeing none, BPS, is there anyone on the public line for neutral testimony on Senate Bill 260?
Chair, there are no callers to testify neutral at this time.
All right. Would you like closing remarks? Waiving closing remarks. Thank you so much for being here. Well, that will close the hearing on Senate Bill 260 and move on to our last agenda item, which is public comment. Is there anyone, public comment is limited to 2 minutes, so we can ensure that everyone has a fair opportunity to speak. You may also provide written testimony if you would like, or written public comment. We will start in our physical locations and move to the phones. Is there anyone in Carson City or Las Vegas to provide public comment today? Seeing no one, approaching the desk in either buildings. We'd move to the phones. BPS, is there anyone on the public line to provide public testimony or public comment today?
Chair, the public line is open and working, but there are no callers at this time.
All right, well, that brings us to the end of our agenda today. We have, what is today, Monday? We have a long committee hearing, 4 bills on Wednesday that we'll have to squish between floor and our afternoon committees. So please come prepared with snacks and appropriate attire. With that, we are adjourned.